feel so far away, but. Okay, so welcome to the Faculty Academic Staff Forum Series here at UW Eau Claire. This is the first presentation of the fall 2025 semester, and I am delighted to introduce our speaker, Dr. Melissa Skoff, family nurse practitioner and adult gero acute care nurse practitioner. She's assistant professor in the Department of Nursing. With over a decade of experience in clinical practice and nursing education, she specializes in adult gerontological and family practice education. Her scholarship centers on advanced care planning and empowering future clinicians through experiential learning. She is a certified Respecting Choices advanced care planning facilitator instructor. Dr. Skoff recently attended a national conference, the End-of-Life Nursing Education Consortium, on incorporating end-of-life care into the nursing curriculum. Dr. Skoff is an advocate for integrating meaningful end-of-life discussions into nursing education and participates in statewide initiatives. She has received the Wisconsin Nurses Association grant and the Medical College of Wisconsin grant in the academic year 2024 to promote her scholarly activity. And today she will share with us a student-centered initiative aimed at building competence in advanced care planning among undergraduate students. You can see the title of her talk behind me, Beyond the Directive, Empowering the Future Healthcare Workforce to Confidently Engage in Advanced Care Planning. Now, before I turn things over to Dr. Skoff, I'll note that we'll have some time at the end for discussion. So I want you to be thinking of your questions. And for our viewers on Zoom, if you have questions, we encourage you to submit them using the Q&A function, which should be at the bottom of your screen. And our graduate assistant, Ethan, will read those aloud. And Dr. Skoff, I have one request for you. When we have questions from the audience, if you could please repeat the questions for the viewers on Zoom, because otherwise they don't hear the question.
Yeah, of course.
So please join me in giving a warm welcome to Dr. Melissa Skoff.
Hello, everybody. I'm happy to be here today, opening for the Faculty Forum. So as Erica so kindly introduced me, my name is Dr. Mel Skoff. Please call me Mel. This is our research team, so they're my first and foremost. I want to thank my team for helping, and boy, we make a great one. So we have myself, I'm the PI, and then I'm working with Dr. Mimi Sword. She's the co-PI. And then we have Emma, who's the brains of the operation, our graduate student. She's an MSN nurse educator student. And then Brandon and Aaron are both BSN students. Aaron has graduated and is working his first RN job. And then Brandon will graduate this next coming spring. So we've been working together closely with the help of ORSP for the grant funding. So here, this is just a picture of our team, and I'll get more into the initiative here in a few slides. But I just wanted to include a picture. And the lead physician from the Medical College of Wisconsin came to our grant event in April with his fellow who is studying with him. So I'll explain more in a moment. So I wanted to kind of start with how I came into this scholarship area. So I noticed from my very first job as a nursing assistant in 2011 on a rehab unit that many folks had not had end-of-life conversations with their family until after a traumatic event had happened. So a lot of the patients I cared for were post-stroke or post-traumatic ICU event or a big accident or something they were recovering from. So I first noticed in 2011 that many folks were not having these important conversations. And this is my husband, Michael, by the way. He deserves a doctorate of his own with all the support he's given me over these many years of education. And so then I went on to graduate with my BSN in 2012. I took my first job in medical telemetry, and then shortly thereafter in the medical intensive care unit. And then I notice even during the time of crisis, not even after the crisis, folks hadn't had conversations with their family as far as what their wishes were, So going into an ICU stay, it was panic many times, crisis mode. Folks just they weren't on the same page. Even spouses who had been married for many, many years had never talked about end of life or what their wishes were. So I went on to I discovered the Respecting Choices program out of Gunderson in La Crosse, Wisconsin. And I did their First Steps Facilitator training. So learning how to have the conversations. They provided some really good tips on just practical things and how to have this conversation. I really felt ill-prepared after my first 2 bachelors and even working, with where do I even start having that conversation? Everyone is in tears, everyone is in crisis, and I'm stumbling over my words, unsure of how to say these really sensitive things in that moment. So that training was really helpful. So that was back in 2013. I did my first training there. I then went on to my DNP project, my doctorate project, and I did a small pilot study in a local clinic near Rochester, Minnesota, that focused on me as the facilitator working with patients and families outside of the family practice setting to complete their healthcare directives. And we were very successful with that. So choosing my scholarship project area of focus when I came to UW Eau Claire was a natural fit. I wanted to dive in more to how I can educate graduate students and undergraduate students and improve the end-of-life conversations with patients and families before the crisis. So we began with our literature review, our first literature review, I should say, in the summer of 2024. Erin, Shu, and I dove into the literature to see what we would find. And I had done a lit review for my doctorate project, but of course that had been several years before, so it was fun to see that updated literature. So first, just kind of briefly overviewing what we looked at, we focused on undergraduate curriculum and nursing education and how nurses at the bedside feel about goals of care and end-of-life discussions. So that was really our first goal to look at. 16 articles met the criteria for closer examination. So we reviewed those closely. You can see our databases there that we looked at. A couple things that we found, folks were reporting that they didn't feel prepared because they couldn't practice. So they may have learned in concept what palliative care was or hospice, but most programs don't offer a way to practice those skills in person. Many students reported they didn't feel prepared in their communication skills, and they felt that there was gaps in the curriculum, and that perhaps it would be helpful to learn this in school before going into practice and applying these skills. So again, to reflect those gaps, we found curriculum inconsistency. Many programs don't address this much more than an hour or 2 of maybe a palliative presentation, and that kind of is that. And again, the lack of practical experience, either simulation or in the clinical setting. So many programs don't offer either necessarily. So if the student happens to stumble upon a situation in their clinical that they can practice, that's great, but it's kind of few and far between is what the literature is suggesting. And of course, this reflects, resource scarcity and faculty resources, simulation support, clinical scarcity. If you look at this last 5 years since the pandemic, many of us have had to navigate challenging clinical situations. We don't always get the hours that we hope or the settings or, not to mention all the things we had to do to navigate during that pandemic. So it was interesting to see the literature back in 2013 through 17 when I was doing my DNP project versus now post-pandemic. It appears just from the articles we reviewed that simulation was a bigger emphasis because students weren't able to get into that clinical environment as much as we would hope. So we thought, okay, well, what do we do with this information? So then I've got lots of things, a million directions I'd like to go. But our first goal was to do a time-limited event for Healthcare Decisions Day, we called it. So here's our little poster. Aaron and Brandon kindly designed the poster, and they planned the food. So we had the best turnout for undergraduates. So we were all, Mimi and Emma and I were all in agreement that the boys were the best ones to plan the food. So so Healthcare Decisions Day, if you don't all know, is April 16th every year that we call attention to healthcare directives. So some of the initiatives, I'm on the Wisconsin Serious Illness Coalition. Every year we plan an event, to kind of call attention to a healthcare directive, explain what it is, get the community involved. And so we started, this was our first event, our first grant we had ever applied for with the Medical College of Wisconsin. And their emphasis is on educating the healthcare workforce. So not just nurses, but therapists or med students or public health, any of those, social work, of course, any of those folks. So we designed an evening event with free food for any students who were wanting to attend. So I created a presentation first where we just kind of went through advanced care planning. What is a healthcare directive? What is a code status? So initially just had to sort of read the room, see who was in attendance and kind of what direction we needed to go. With these topics, they're all very detailed, and I could talk for 3 days just about skills for end-of-life care planning and goals of care. So we just had to kind of tailor it to the audience. And so we worked on an overview of what it is. We talked about some key communication skills like motivational interviewing, empathetic language, checking for understanding, listening, kind of the basic skill set. And then we designed a role play for helping them for an opportunity to practice. So we had, and we also had some educational materials that we handed out, tip cards for their scrub coat if there were nurses that they could put in their strategies to facilitate a goals of care discussion if they were to come across that opportunity in their clinical learning environment. And I tried to engage them as much as possible. So I really enjoyed, there was a political science student that wanted to be a lawyer. So we talked a lot about the legalities of healthcare directives and helped them understand. So, and there's some questions where you're like, why do we do it this way? Because if you don't all know that each healthcare directive is different based on the state, and each state has a different rule. So if you were to go to Alina in St. Paul, it might be different than if you went to Mayo Clinic in Eau Claire or, Mayo in Rochester or wherever you go. It's not consistent, and there's no way to get that healthcare directive into the medical record easily. So anyway, we talked a lot more about the legalities than I was expecting, but that was part of the fun part. So, and we had several nursing students who shared their clinical experiences so far and even their personal experiences. The one student said, I'm texting my mom right now. We need to go through this as a family. So that was pretty fun to see. So I would say our event was very successful. We, didn't, of course, get as much attendance as we had hoped. I think some of the, I'll get to lessons learned here, but it did show statistical improvement. We did the pre and post survey, just gauging the students' understanding going into the event and then what they had learned after the event. And they all seemed to value the practice. We had talked about a situation where if you or your loved one had what the doctors would consider brain death, that your body was completely fine and going to live on, what would you want to do? A lot of students were kind of shock and awe initially because they had never really thought about it. So we had a lot of good reflection from that conversation. So it was really good practice, and they were able to partner up and practice those communication skills we had touched on. So yeah, it was a lot of fun. Good food and good conversation. So some challenges we encountered, of course, scheduling conflicts. You know, when do you schedule something in person? We really felt like the in-person would be more valuable, at least initially, when we're practicing, you know, student with student. All the training I've done as the facilitator instructor is on Zoom, so I think it's something we could work towards incorporating more of. I think you'd get better attendance if you allowed Zoom, just with nursing and clinicals, and there was a simulation lab happening at the same time, so that took away a few students. But for the most part, I was, yeah, very grateful for who came with. So we also talked about, you know, do we include, you know, do we coordinate with other departments, or do we just start with nursing, or do we include physical therapy and public health, and kind of who do we include? We just opened it up to everybody. Initially, we were just going to do nursing, but I thought, well, let's just see who will come. So we just kind of opened it. So we had a smattering of public health, and the political science was a little bit of a surprise, but he was really interested. So anyway, so things we could learn for the future. Scheduling, offering a virtual event would be helpful. And then, of course, doing more advertising is always good. So we just had our one poster that we emailed to everybody and then circulated around campus. And again, Aaron and Brandon, they were going around telling all their buddies to come get free food. So that was really helpful and effective word of mouth advertising. So here's just a slide about the audience composition that we already kind of touched on. So mostly nursing students, but then public health and then political science. So we had 19 folks who attended, 18 folks took the pre-survey and the post, well, 10 only took the post-survey. So I guess just kind of natural consequence of, you know, if they had to go to a clinical or leave early to go to a class or that kind of thing. So where are we going from here? So that was a lot of fun. We learned a lot of things. So like Erica mentioned, Mimi and I attended the ELNEC, the End of Life Nursing Education Consortium workshop this summer that provides a framework for end of life and palliative care education we're hoping to incorporate into the curriculum. We thought we would start with graduate students because it's a smaller scope. We could even narrow further and focus on adult gero students versus family at first. We're kind of working through how to navigate that. Of course, funding is always an issue. The ELNEC is the most achievable as far as cost goes from what the research we've done. So that will be one of our goals this year, this academic year. And then we've looked at collaborating with other entities. I'd love to have respecting choices workshops like once a year or twice a year to certify students to be facilitators. So that's what I've gotten my instructor for. So I could hold workshops or that kind of thing. We'll see where that goes. We've looked at Fox Valley. They have a lot of volunteer stuff over by Appleton where students could go and practice. We've also looked at Mayo Clinic, and we're just kind of feeling through what direction to go. All right. Here's our team. Yeah, so I just, do we have any questions? Anything I can answer? I know it's the beginning of the project. This was our first grant, so. Yes. Yeah.
A couple of questions, but I'll start.
Yeah. Yeah.
How do you recommend, you mentioned this one student who was texting her mom and
Yes.
to have these conversations. How do you recommend families start these conversations?
That's a great question.
If my example of, you know, I go to the doctor, they ask me about advanced care,
Yeah.
they'll give me the little pamphlet. And then
It usually,
that's kind of it.
right.
You can repeat the question for.
Yeah, so Erica asked, what is the best recommendation to start the conversation? That is so, so common. And, you know, it usually ends up as a, you know, that pamphlet ends up in the glove box or the center console or, you know, you know, your end table where you put your coffee, you know, it's so hard because, you know, life is so busy And I know if you're like me, you know, you're just running through like, okay, did we go to the store? Did we, you know, get the baby what he needs? Do we have this to survive the next week? So it is really hard. The first thing I would suggest is to schedule it. To say, okay, if you're going to go with, you know, your spouse or mom or dad or children, the key is to get your power of attorney involved. So the person that you want to be your decision maker, that is your first go-to person. So if you think, yep, I would want my husband for sure, schedule it. Because if you don't schedule it, it won't happen. So that would be my first step. And there's all sorts of resources online that you can review. Healthy Choices Wisconsin is a good one. Respecting Choices is a great one. They have a bazillion resources to actually do something with that information. That was one of my hopes, that, you know, in partnership with local healthcare systems, we could create a program where students would meet with patients and families outside of their primary care appointment to have the conversation, to have it scheduled. It's an appointment, just like everything else. You gotta get to the appointment. So that's one of the barriers I found in the literature. There just isn't time to have the conversation because the health systems typically expect the primary care provider to have that conversation, but they're coming in because they need their Lasix refilled. They had a CHF exacerbation and they just got out of the hospital. They have cellulitis. They have, you know, any number of acute medical conditions going on. It's really hard to have time. And the pilot study I did, those conversations lasted 1 hour, typically on multiple occasions, before the directive would actually be signed. So I know Respecting Choices talks about it a lot, but they emphasize more of the conversation, but healthcare institutions tend to emphasize the document and the completion, because you can talk all you want and all the conversations in the world, but if you don't have the document signed correctly in the medical record, it's not going to be useful in those crisis situations. Was that helpful? Yeah. Hopefully. So scheduling it, I guess, is the first step, and identifying your power of attorney. Yes. Yes, Delete.
Thank you for sharing your
experience
working with students. Project, which is very important.
Yeah. Yeah.
I wanted to say that I wanted to ask a question, but first
Yeah.
just comment on the fact that having started this project and doing it on that National Day back in April.
Yeah.
It's good.
Yeah.
And if you keep on doing it,
Right.
it will become more solid. And
Right.
integrating the other departments like social work, public.
Right.
Like you said,
Right.
but making it like a standard day, and we have
Right.
campus meet to talk about it.
Yeah.
And make it stronger and stronger. Just like we have the Pink October, right?
Yeah, right. Yeah, exactly.
Started with one place and then suddenly it's an international.
Right. Absolutely. Yeah, I appreciate that. Yeah.
Well, I wanted to ask you, how was your experience with the student, teaching them how to go through like doing a literature search? And you said the master student, she was the brain.
Yeah.
Like, whoa, what did you get her to do? And how was her involvement? So I just.
Yeah, the roles of the students.
To work with students because of their busy schedule.
Right. Right.
Sometimes they don't have experience with a certain type of research design.
Right. So we started with, it was just Erin and I, summer of 24. And then in the fall of 24, we added Emma and Brandon. So that was really huge. So we kind of went from this like super small, just him and I. We met once a week over that first summer via Zoom. We just scheduled half-an-hour meetings to kind of go through how to do the lit review, what he's looking for. We also met with Helena Sambola from the library. She is amazing. She is like so helpful. I learn every time I talk to her to help us both learn more about the literature review process. So that went, I would say, pretty smoothly. Aaron had the summer, I forget, I think he was working some, but he didn't have any classes and he was working part-time. So I felt like we were able to make some good progress there and then prep for the fall. Then when we added Emma in the fall, she was really sort of the brains of the operation. I always say, oh, she's graduating in the spring. Oh no, what am I gonna do? You know, I just love Emma. She's awesome. But she really helped to coordinate kind of Brandon and Aaron, if that makes sense. So it was like me and then Mimi. We would come up with the ideas, you know, review the literature, and she did a lot of the searching, like helping with the grants and finding grants. I know we met with Erica, we met with Heather several times, you know, how to find what we need to do and then identify the requirements. Okay, so we need to do, you know, this type of abstract or this type of manuscript. So she was helpful in the researching process and then helping guide the undergraduate students. So that was really good. And she's an MSN education student, so she really enjoys the curriculum type of stuff. You know, now we're looking at the curriculum. She's really interested in that. So yeah, we've been working well. And this summer we were able to get ORSP funding as well. So we were able to start, we did another lit review looking at graduate students and curriculum specifically. So that's kind of that next layer when we're looking to incorporate LNEC hopefully at some point. And then we got a good start on all the applications for the conferences. So so that's really good. We're hoping to present at NOPF in April, and we're hoping Emma can go with to that one. She's interested in the education one, and then Brandon will do NCUR and Madison and Circa again. So we'll all have a poster or presentation of some kind. And then Mimi and I got accepted to a year from now, Paris, France. So for a nursing diversity conference. So that will be really cool. Incorporating some of the things we've done, some of the things we're planning to do. So that'll be really fun to do. So we really focused on applications, submitting a manuscript, because neither of us has been published yet. So we're really working on that this semester. So did that answer your question? Yeah. We meet frequently via Teams. So in the semester, we just schedule a half an hour every Thursday, and we meet and we just talk about what are you doing? What am I doing? I've used Trello as a tool. That's like a project management software. It's like each task and down the line what needs to be done. So especially when it comes to traveling, we felt like, okay, how do we make sure that Brandon's got his flight, you know, we've got our hotel, and you know, it's just like so many moving parts when we went to like 6 conferences. So any softwares are helpful tools, but communication in Teams has been really helpful. Yeah, thankfully we have an amazing team. So I know Brandon's looking for the next recruit for the next year of projects. So we'll see which undergraduate, but yeah. Thank you. Yeah. Yes. Yes.
What do you recommend when you're trying to have the conversation with there's resistance?
Yeah, I know. That's hard. Yep.
Yeah.
Exactly. Exactly. Yep. Yep.
Maybe resistance, and I imagine.
Yeah. Oh, absolutely. 100%. So as my clinical practice being a hospitalist, I have end of life conversations every single shift, many times, multiple, you know, doing hospitalist medicine. It's a lot of, you know, terminal cancer, end stage heart failure, COPD, you know, they just get admitted over and over and then they just kind of decline. So, I guess my strategy, both personally and professionally, is to not give up and to, I guess, express where you're coming from with those requests, you know, love and kindness, wanting to do what they want you to do, you know, instead of you need to be a DNR because you have CHF and you need to do this, you know, type of thing. So I really try to approach it from a loving, empathetic, you know, perspective. And if the patient is not ready, just try again, you know, in whatever time frame. You know, we learn about these like pre-contemplation, contemplation, you know, the action and the doing, you know. So if they're in pre-contemplation, they're not even thinking about it. They're like totally, you know, not even remotely ready to receive that information. So I think that's part of the art of medicine is it takes time and it takes different strategies and multiple conversations. So that's part of the challenge with the checkbox mentality. Oh, I got this document done, check, you know. I've had so many healthcare directives where it was the deceased spouse or the ex-spouse from 20 years ago, or, you know, the son or daughter who is, you know, hasn't talked to him in 20 years, you know, so these need to be updated every decade. So they say decade, death, divorce, or diagnosis. So anytime those things happen, so every 10 years, anytime there's a death in the family, you have a diagnosis or you get divorced. So it should be like our retirement fund. We're going to look at our retirement fund. We're going to review things. We're going to look at things. It should be part of that kind of regular rhythm of life. But it's not. That's the problem. Only about 30% of adults have a healthcare directive. And any person 18 years of age or older should have one. So if something happens and, you know, we get in a terrible accident and we can't speak for ourselves, then it depends on the state. And a lot of times that guardianship then goes to the courts, you know, and you should have a financial power of attorney, a medical power of attorney. You know, a lot of people say, yeah, I got a will, I'm good. You know, that helps with your bank account, but if you're in the ICU on a ventilator with a feeding tube, you know, that healthcare institution will do what they feel is best, not what you want. So hopefully that helps. Yeah. It's hard. It's an art. Yeah, it's really, really an art. So yeah. They do. Yeah, right. That's right. We just say, well, yeah, exactly. And it's interesting, La Crosse County, where Gunderson is located, the Respecting Choices has been around about 25, 30 years. Their completion rates for healthcare directives is 96%. They have facilitators who meet with patients and families outside of appointments. That's why I'm like, I just want to work with health institutions because it works. We know that it works. It's just the funding to get the resources, to have the manpower, to pay that person the 1 hour of their time to meet with all these folks. But it's a great example, and how they have it set up with, you know, you just like you go to set up an appointment with your endocrinologist or your physical therapist, you set an appointment with your facilitator. You might have 3 or 4 sessions, and then you get the document completed, and then, oh shoot, I got diagnosed with XYZ. Make an appointment with your facilitator. You know, so it works. That's what La Crosse County does. So it's really a great example. Good. Any other questions I can answer? Yeah.
So, it sounds like right now, your efforts are largely extracurricular. You mentioned integrating it into the graduate curriculum.
Yes.
What would be your dream, let's say, for
Yeah.
integrating something like this into the undergraduate curriculum?
Yeah.
Vision.
I would love that. That would be a dream come true. So I would love to have those facilitator trainings as part of each curriculum. So each student can get that at least 8 hours of focused practice and strategizing of how to have the conversation and what to do and all the resources. And then I'd also love to have like the LNEC curriculum that goes through palliative and hospice care. So they have the undergraduate curriculum and then they have the graduate curriculum. The graduate curriculum is focused more on the prescribing and the medications and comfort, but then also leading the conversation, because we know nurse practitioners have a different role than RNs. Both are very valuable and important, but we know that they're different. So if I could snap my fingers and say, yep, this would be amazing, we could do the education in the program, both undergraduate and graduate, and then have community opportunity to practice, either in the form of, a healthcare system or a community event or something else. We have the Death Cafe is a really interesting concept. It's a community initiative where folks get together and talk about, they call it the Death Cafe. They used to call it like cake and death or something. I don't know. It's just crazy. A lot of times at local libraries, they'll get together and talk about death. I don't think they specifically do the healthcare directive, but I think that's something nursing could really impact. We could offer community gatherings that way. So I'd love to teach it and then do it. And the graduate especially, we have a software called Typhon where you chart, okay, did I do suturing? Did I do casting? Did I do, these different skill sets? I would love to have a checkbox, end of life care discussions, and require or encourage, say, 10 or 12 or 15 hours of end of life discussion leading as part of their clinical. I would love that. Because we know that we need to teach it and then we need to do it. Because it's really hard when there's a room full of 20 people, they're all crying, maybe they're screaming, maybe there's yelling, there's disagreements, and you're sitting in that center of the room with your white coat on, and you have to figure out how to lead this discussion. So it's like that moment where you're like, okay, I've done this X number of times, I remember this, strategy, so it's so important. And I just felt so ill prepared as a new nurse and as a new NP to have that. So I would love to incorporate that someday.